Welcome to our telehealth medicine information video. I'm Garvin. This video is on Nortriptyline. So what is Nortriptyline used for? It's used for treating depression in adults. Nortriptyline is not licensed for treating depression in children and adolescents under 18 years of age. However, some specialists may still prescribe it if they feel it's essential. It's also used for treating nerve pain or neuralgia or neuropathic pain in adults. For example, caused by nerve damage as a result of diabetes, stroke, or injuries, or chemotherapy, or amputation, or shingles. So this is an unlicensed use of Nortriptyline. So how does Nortriptyline work? Nortriptyline hydrochloride is a type of a medicine called a tricyclic antidepressant. It works by enhancing the activity of neurotransmitters serotonin and noradrenaline in the brain. Neurotransmitters are natural body chemicals that act as chemical messengers between the nerve cells. Serotonin and noradrenaline are neurotransmitters known to be involved in regulating emotions, mood and behaviour, among other things. In depressive illness, less serotonin and noradrenaline than normal is released from nerve cells in the brain. Nortriptyline works by stopping the serotonin and noradrenaline that has been released from being reabsorbed back into the nerve cells in the brain. This helps to prolong their effects, and over time this helps to lighten mood and relieve depression. Nortriptyline won't change your personality or make you feel instantly happy and relaxed. It works over time to correct the chemical changes in your brain that have made you become depressed and helps you get back to feeling like your old self. So it's not fully understood how Nortriptyline relieves nerve pain. It's thought to work by enhancing the nerve signals within the central nervous system that naturally reduce pain messages arriving in the brain. How long does Nortriptyline take to work? In depression, it may take between 2 to 4 weeks before Nortriptyline starts to work and you begin to feel better. So it's very important that you keep taking it, even if it doesn't seem to make much difference at first. You usually need to keep taking Nortriptyline every day for several months, and for at least 6 months after you feel better. You should keep taking it for as long as your doctor recommends you to. If you feel your depression has gotten worse, or if you have any distressing thoughts or feelings about suicide or harming yourself in these first few weeks, or indeed at any point during treatment or after stopping treatment, then it is very important to speak to your doctor immediately about this. With nerve pain, Nortriptyline may start to help in a few days for some people, while others don't see much difference for 2 to 3 weeks. It can take several weeks for you to see a maximum benefit of this medicine, so it's important to persevere with taking it. You should then keep taking it for as long as your doctor recommends. So how do you take Nortriptyline? You always follow the instructions given by a doctor regarding Nortriptyline dose. So remember that it takes a while for Nortriptyline to start working. So keep taking it as prescribed, even if it doesn't seem to be making much difference at first. Do not take more than the dose prescribed by your doctor. Nortriptyline is usually taken 3 or 4 times a day, although it can also be prescribed as a single dose to be taken at bedtime. So you follow the instructions given by your doctor and try to always take your doses at the same times each day. This will help you to remember to take them. Nortriptyline tablets can be either taken with or without food, on a full or empty stomach. If you forget to take a dose at your usual time, take it as soon as you remember, unless it's nearly time for your next dose. In this case, leave out your missed dose and take your next dose as usual when it's due, and do not take a double dose to make up for an earlier missed dose. You should keep taking Nortriptyline regularly until your doctor tells you to stop. When treating depression, current recommendations are that antidepressants are continued for at least 6 months after recovery to help prevent depression coming back after the medicine is stopped. Nortriptyline is not addictive. However, do not suddenly stop taking nortriptyline because this can cause withdrawal symptoms such as feeling sick, shivering, headache, difficulty sleeping, sweating, irritability, restlessness or anxiety. Withdrawal symptoms are temporary and are not due to dependence on the medicine. They can usually be avoided by stopping nortriptyline gradually, usually over a period of weeks or months, depending on your individual situation. So you follow the instructions given by your doctor, and when it's time to stop treatment. Who shouldn't take nortriptyline? So people with severe liver disease, and who might need a lower nortriptyline dose or extra monitoring. So these would be elderly people, people with liver problems, people with heart disease or high blood pressure, people with an overactive thyroid gland, and people with a tumour of the adrenal gland. Also, extra monitoring for people with chronic constipation, people who have difficulty passing urine, such as men with an enlarged prostate gland, and people with raised pressure in the eye or glaucoma, people with diabetes, people who suffer from epilepsy or at risk of having seizures, for example, due to alcohol or drug withdrawal, or brain damage or other medicines. Also extra monitoring for people receiving electroconvulsive therapy, people with psychotic illness, people with a history of bipolar affective disorder. And this medicine should be stopped in people entering a manic phase. If your child is prescribed nortriptyline, it is very important that they are encouraged to report any distressing feelings, thoughts about suicide or self-harm, irritability, aggressive behaviour, mood changes, or other unusual change in behaviour that they may experience while taking this medicine. If you notice a change in your child's behaviour or are worried about them at any point, it is important to talk to your doctor immediately. So can you take nortriptyline while pregnant or breastfeeding? So it is important to get medical advice from your doctor if you think you could be pregnant or you want to plan a pregnancy while taking nortriptyline. Nortriptyline should preferably not be used during pregnancy, particularly in the first and third trimester, because its safety has not been fully established. However, it's important to talk to your doctor about the risks and benefits of taking nortriptyline compared with stopping treatment or using other treatments. For example, if nortriptyline is taken during the third trimester, it could cause side effects or withdrawal symptoms in the baby after birth, and the baby may need extra monitoring because of this. So just some things to consider. If you get pregnant and decide to stop taking nortriptyline, don't do this suddenly. Your doctor will give you special instructions on how to stop treatment gradually to avoid getting symptoms of withdrawal. Get advice from your doctor if you want to breastfeed while using nortriptyline. Nortriptyline passes into breast milk, but only in very small amounts that are unlikely to be harmful to a nursing infant. If you're taking nortriptyline, it's usually fine for you to breastfeed provided your baby is healthy, wasn't born prematurely, and is monitored for potential problems such as drowsiness. However, always check with your doctor first because various other factors need to be taken into account before you breastfeed. So what are the possible side effects of nortriptyline? They'd be dry mouth, blurred vision, constipation, feeling sick, dizziness, particularly when getting up, headache, tremor, fast heartbeat or palpitations, flushing or sweating, feeling weak or tired, confusion or problems concentrating, pins and needle sensation, involuntary muscle movements such as twitching, sexual problems such as reduced sex drive or erectile dysfunction, change in the way things taste, So for more on the risks and side effects, you need to read the patient information leaflet that comes with the medicine, or you can talk to your doctor or pharmacist. So can you take other medicines with Nortriptyline? If you need to take a painkiller, it's fine to take paracetamol, aspirin or ibuprofen with Nortriptyline, assuming these are appropriate for you. You shouldn't take cold and flu remedies that contain the decongestant such as pseudoephedrine or phenylephrine while you're taking Nortriptyline. Avoid taking excessive amounts of stimulant laxatives like senna or bisoconazole while you're taking Nortriptyline. If you need to treat constipation, ask your pharmacist for advice. If you need an antihistamine, it's best to avoid those that can make you sleepy, like Piriton and promethazine. So go for a non-sedating one, like cetirizine or loratadine. What about prescribed medicines? So you're more likely to feel sleepy on Nortriptyline if you also take other medicines that can cause drowsiness, such as the antipsychotics such as haloperidol. So for more, talk to your doctor or pharmacist on any possible interactions with your medicines and Nortriptyline. They're wide-ranging and you need advice from a doctor or pharmacist for this. So that brings this video to an end. If you have any questions, you can leave them in the comments below. Contact us through our website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas Cork, or ring 4366923 to find out more. Thank you for watching. Stay healthy and stay informed.